morning, everybody. I'm very pleased to be here at St George Hospital with the Minister for Health, Minister Hazzard, with our Chief Medical Officer, Dr Kerry Chant, and also Susan Pearce from the Department of Health. And I wanted to give a special shout out to Susan. Her and her team have made sure that New South Wales has remained on track with our vaccination rollout. And it's very exciting today to be able to provide the AstraZeneca vaccine also to key frontline workers that we've been vaccinating here in week 3. We said in New South Wales that we hoped to vaccinate around 35,000 people in the first 3 weeks, and we'll be getting very close to that number. I'm very pleased to say that as at last night, we'd already vaccinated 27,000 people in New South Wales through the New South Wales health system. That does not, and can I make this clear, that does not include those who've been vaccinated through the federal government's aged care providers. So as far as the New South Wales health situation is concerned, as at last night, we've done 70,000 people, and of course today with St George and Hornsby coming on board, it does allow us to increase our capacity of how many people are able to get the jab on a daily basis. I also wanted to make this point very clear. New South Wales is very pleased to be able to be open and transparent as to how many people get the vaccine. Can I make it very clear that New South Wales was not one of those states that objected to figures being provided? We've also always believed during the pandemic it's best to be upfront with our public, and at any time the federal government or anybody else wants access to those figures, we're happy to provide them. But I'm extremely pleased with how it's going, and today Minister Hazzard, Dr Chant and I will be getting the AstraZeneca vaccine. And it's important to remind the people of New South Wales that most of you will be offered the AstraZeneca vaccine. Now, the efficacy or how effective the AstraZeneca and Pfizer vaccines are has been shown to be pretty much the same. They're both as effective as each other, and what is important is for us to be able to vaccinate as many people as possible as soon as possible, because we know that when the vast majority of the population is vaccinated, that increases our ability to not only ease restrictions, but to start thinking beyond our national borders and what it means for international travel. We know the biggest hindrance to our economic development and growth in the next little while will be our ability to open up to the rest of the world, and that is a really important prospect for New South Wales. We've always believed that it's in our state's interest, in our nation's interest, to make sure not only that we keep the virus at bay, but also that we have an eye on jobs in the future, and that's certainly our thinking moving forward. I also wanted to stress that I've made clear to the federal government that at any time, in addition to the GP network, where the GP network is where most people will be asked at the right time to contact their GP and get the vaccine. We've also offered to remain standing our 100 hubs around the state, which are provided by New South Wales Health. Previously, the vaccine would have been rolled out just through the GP network, but we are keen to support the federal government's efforts because we want our citizens to get vaccinated as soon as possible. If other states are going a bit more slowly, that's a matter for them, but as far as New South Wales is concerned, we want to get as many doses out as possible. And in relation to the doses, can I say that we're really pleased to be able to receive, and have received, some of the new syringes that let us get 6 doses out of a vial instead of 5. If you look at the figures that the federal government has provided, they say that New South Wales has given out 74% of the doses available to us. But if you counted 5 vials, 5 doses instead of 6, it would mean that we were closer to 90% of getting the vaccine out. But now that those new syringes have been provided to New South Wales Health, it means we can get 6 doses out of 1 vial, sorry to get so technical, which means we'll aim to have closer to 90% of the doses getting out in the week that we receive them, which is our intention. And that's certainly something we're looking forward to. So we appreciate that every nation around the world always has challenges when you're doing max vaccinations. But what I can say about New South Wales is our population has been absolutely positive about it so far. I asked Susan Pearce from New South Wales Health today what the rates were like of people coming forward, and she said there were virtually no-shows, there were very few for obvious personal reasons, but the vast majority of people were very enthusiastic, and the response has been very positive to the vaccine, and most people obviously until this time have received the Pfizer vaccine. And it's also interesting to note, if I can make this point clear, that if you have the Pfizer vaccine, you wait 3 weeks before your second dose. If you have the AstraZeneca vaccine, which is the one I'll be getting today, you wait 12 weeks before you get your second dose, and that means you've completed your dose. So I'll get one jab today and then come back for another one in 12 weeks' time, and that means I've completed being vaccinated from COVID.